Hi, my name is Cynthia de Santos. I am from Houston, Texas. I have a license in marriage and family therapy, LMFT, and I provide mental health services to deaf children and their families both in private practice on the side. And my full-time job is at HCC, Houston Community College, as a disability services counselor. I am happy to be here today to co-present this wonderful topic.
And I'm Leisha Campbell. I work full-time at the Galveston Brazoria Cooperative for the Deaf and Hard of Hearing, where I am the counselor. And in addition to that, I also have a private practice where I provide mental health services to deaf and hard of hearing children and adults. And I'm excited to be here to co-present this topic as well.
It's such an honor for me to be here today, to have this opportunity to give insight and share about topics that continue to affect the deaf community. I hope you leave today with an increased awareness when you interact with deaf and hard of hearing youth. We will touch on unique types of trauma that typically happen to deaf and hard of hearing children, and what to look for when selecting a mental health provider to ensure that your child receives quality, trauma-informed care that is needed. Why is this topic so important? It's important to understand the types of trauma and how that affects children throughout adulthood, and how it is important to do trauma-informed care for this population. The National Association of State Mental Health Program explains that research shows that there is a significantly higher incidence of trauma among deaf people that occurs in a variety of forms: verbal abuse, physical abuse, sexual molestation, and those have long-term negative consequences for deaf children. Deaf children are more vulnerable to neglect, emotional and physical abuse than children in the general population. These are the most recent statistics that we've found. 50% of deaf girls have experienced some type of sexual abuse as compared to only 25% of hearing girls. 54% of deaf boys have experienced sexual abuse as compared to only 10% of hearing boys. Deaf female undergrads at the university experience some type of physical assault or psychological aggression or sexual coercion at twice the rate of female undergraduates who are hearing. Unfortunately, only 2% of deaf individuals actually receive the appropriate psychological services that they need. The rate of those deaf and hard of hearing people receiving psychological services is very low, and that's why this topic is so crucial. Let's look at the unique traumas that deaf and hard of hearing children typically face. Information deprivation trauma, IDT, is a unique type of trauma that can be experienced by the deaf community. This is defined as trauma or more traumatic because the informational knowledge is limited or not available at all. But lack of information may cause another level of trauma because it causes feelings of surprise or unpredictability and uncontrollability. Mentally, the person will feel more stress, more anxious. They may become more depressed because their sense of self or security is jeopardized. Naturally, we need to know what would happen to us mentally in every situation. IDT can occur to a deaf person because of a variety of reasons. The family tries to protect their child with no bad intentions. They may believe the less they know, the better. Lack of access to communication to find out about well-being of loved ones in disasters. When there are conflicts within the family, the deaf child may be left out with no explanation and may be unaware of what's going on, and so they come to their own conclusions. Lack of warning of significant events. For example, when there is a tornado coming or a flood. Just recently, we had the winter storm that affected so many of us were trying to survive without electricity, without water. So all of those, the deaf child may have no information about that, and that causes more stress. And that type of situation can be life-threatening. Those deaf children need some kind of warning, some kind of information. Language disfluency is the inability to communicate fluently in any language. Often there is no exposure to language, and language is not developed at an early age, and that can affect their emotional and social development. Language deprivation can cause language disfluency. Considerations for effective counseling services. Deaf and hard of hearing children often need trauma-specific mental health services to ensure their safety and to equip them with skills that they need. They need to be able to cope with their trauma and experience. As Dr. Harvey in his article explained, to be a trauma-informed provider and provide the care involves professional relationships and interventions that take into account the history of the individual and the trauma that they have experienced in an effort to promote healing and growth. This includes an understanding the connection between one's present symptoms and behaviors and how that is connected to previous traumas and vulnerabilities or triggers that traditional service providers and approaches may exacerbate, that do not inflict further trauma on the individual or reactivate past traumatic experiences. In the most ideal world, having a fluent therapist in ASL will definitely remove communication barriers and misunderstandings, but lack of resources in this area is common. The second best option would be to find a certified interpreter who can commit to working with that therapist and the deaf client to provide a better outcome than requiring the deaf client to lip read, simply because research shows that only 6 to 30% of speech can actually be lip read, and it is not a skill that every deaf client will have. Also, under duress, experiencing anxiety or other mental problems, the inability to lip read is exacerbated, and it requires so much work to pay attention, to focus as the memories are coming up. It is simply not the appropriate way to provide therapy. Using their preferred method of communication needs to be set and provided to the deaf client with safety and trust. Talk therapy does not work for everyone, possibly because of their limited language, their inability to express through sign language, or their vocabulary. You need to meet the deaf client where they are. You may have to sit on the floor across from them to enable to establish a relationship. You may use pictures or drawings or dolls. Even with teenagers, you may have to play games to get that interaction and help build the connection, and then provide the vocabulary that the client needs to talk about what has happened to them. It's very important that you have communication access, trust, and safety to provide effective therapy. Sometimes the therapy may need to include family as part of the assessment to see where the child is in their family dynamic or their family system. It's important to not always look at their way of communication, but to make sure that everything in the therapy session is interpreted in sign. If not, the deaf child or deaf client may feel isolated or may experience the same feelings that they do in the home, and that will affect their relationship in the therapeutic session. If communication is not established, then it will be tough to teach the deaf child about safety. And the perpetrator of the abuse will assume that the deaf child won't disclose about the abuse. There will be less opportunity for incidental learning and less understanding of healthy and safe touch. And those types of things can lead to the deaf client feeling more misunderstanding, fear, isolation, and reduced safety. And then they can be at risk for more serious mental health problems or issues. They need to feel understood and validated for their feelings in order for their healing to begin. Some things to include when working with trauma and deaf individuals. Get a detailed history about the client of their hearing loss and their social and emotional development. Assess history of language use and ability to communicate in multiple settings, their home compared to school. Ask about their educational background and what school they attended in the past. Fourth, be aware of the culture, oppression, stigmatization, and isolation that deaf people often face. Consult with specialized providers about bringing culturally affirming view of deafness into your work. Find out about the individual, their family, their past experiences with therapy, and the use of interpreters. Use a team approach where you work to teach the family and the deaf child the words, the signs that apply to what happened to them. Having that language awareness is essential. The therapist may need to put more emphasis on increasing social skills with the deaf child and also help them understand safety. When appropriate, support the family in decreasing overprotectiveness while helping to increase the individual's knowledge of self-protection. Encourage or facilitate the family's use of signing and deaf supports in the community, places where they can go to learn. There are a lot of things that are available online. It may be important to spend a lot of time on the historical lack of communication in the family and their culture, understanding their culture, understanding both views, the medical or pathological model as compared to the cultural model. In particular, the therapist needs to recognize the impact of their deafness, described by Baker and Coakley. The medical mainstream clinicians with the pathological model represents the common view of the dominant hearing community that deafness is a terrible tragedy and deaf people are to be pitied. It's a negative view. The cultural model represents a more progressive approach. It defines the deaf community as a group of people who share a common language and culture, social affiliation, and educational background, and their experiences and knowledge of oppression. With this healthy belief of the deaf community is essential to the psychological well-being of deaf children. Wherever possible, the clinician needs to use a cultural model when working with deaf families or families with deaf children and deaf clients. In their work to be culturally diverse, Sue in the article states that culturally competent mental health professionals must be aware of their own assumptions, their own values, and their own bias. Because the medical pathological view of deafness is pervasive in the dominant hearing culture, therapists working with deaf and hard of hearing children who have experienced trauma need to understand the effects of that negative medical model on these children and their families. Culturally affirmative therapists strive to use psychotherapy in a way that works with culturally different people, thinking about the social structure, the cultural power, oppression, and seeking ways to intervene that are relevant and sensible to the client, empower their clients and the client's community, make connections between the personal and collective experience, and balance their clinical considerations. The pathway to recovery can occur once provided with trauma-informed care, specifically for the deaf and hard of hearing individuals, providing them communication access, inclusiveness in the process, and adopting lifelong coping mechanisms. You can seek resources in your community to see who to refer to. And if you are a therapist or counselor, finding experts in the local community in deafness and hard of hearing culture to maintain a multicultural perspective in your practice.
So we're going to continue with providing additional information about trauma-informed care for the deaf and hard of hearing. Part of that is redefining what trauma is and explaining what that might look like. So of course we know that trauma can be any stressful situation that a person feels that is a negative experience for them. That could be something like an accident, rape, a natural disaster, but it's also just anything that a person finds that is physically disturbing or emotionally a dangerous situation for them. Also, trauma experiences also have different impacts on different parts of our bodies and our emotions. So that may include our brain development. It also may have changes within your body or physiological changes within a child as they are developing. It also can significantly impact their cognitive function and their ability to be able to learn in school. Also, there's emotional dysregulation. Basically, that just means that you struggle to be able to express your feelings positive or in a very appropriate way. So maybe you're feeling anger and the child is yelling, throwing things, clearing things off the table, whereas another child without trauma may just say, "I feel mad." problems with memory and problem solving. So if you have had a traumatic experience early on in your childhood or as you're growing up or even as an adult, you may not be able to remember things long term. You may not be able to solve a problem that someone without a traumatic experience may be able to do a lot easier. And then the last component of that is what we call the fight, flight, or freeze response, otherwise known as survival mode. That basically just means that is something that's intuitive with most of us, that if there is a dangerous situation or we need to be able to protect ourselves, that's a normal response and it's a safety response. However, if that survival mode or that freeze, flight, or fight response continues for a very prolonged period of time, it can cause negative impacts on brain functioning and also the child or deaf and hard of hearing client's ability to function socially. So previously, Cynthia provided some awesome examples of the different types of trauma that a deaf and hard of hearing child or adult may experience. And so in addition to that, there are factors that may contribute or increase the risk of the trauma occurring for deaf and hard of hearing individuals. Some of those are language deprivation. Even though that child may be coming to school, they may be receiving instruction in a deaf education program, they may be getting communication in American Sign Language or through an oral mode at school. If they go home and they do not have that language being provided 24/7, and continuously, they may not have an established language mode to be able to communicate. There's also social isolation. So maybe they don't have peers that they're able to hang out with. They may not have those normal appropriate age development and social connections that kids that are not deaf and hard of hearing have and make easily. There's also bullying. So if a child does not have an established communication mode, or they have an ability to communicate but only at school and not within their home, if they are experiencing bullying, they may not be able to tell their parents, they may not be able to alert anyone that that is happening, and therefore that may continue longer than anyone would be able to intervene to be able to provide assistance to them. There's also rejection of their family of origin. So there are some times when a parent receives the diagnosis that their child is deaf or they're hard of hearing, and the family gets stuck in the grief process. And so they are devastated that that child may not be able to hear, that they may not be able to talk, or they may just be scared that child may not be able to develop as another child would. And they stay stuck in that process. So they don't ever get to the point where they accept that child as the child that they are and provide the supports they need to be able to continue to develop. There's also non-acceptance of being deaf and hard of hearing due to religious and cultural beliefs. There are some religions and some cultures that view being deaf or hard of hearing as a negative thing. For example, they view it as the parents' fault. Maybe one or two of the parents did something wrong, they did something bad, in their past, and that child was born deaf or hard of hearing, and they blame those parents, and those parents bear that burden as the child is growing up. Also, there's just lack of access of direct instruction or information of life skills for a deaf or hard of hearing child or client. Those can include a variety of things, such as just not knowing how to manage money, not knowing how to pay bills, being able to make a doctor's appointment, and being able to have healthy relationships. Some of those examples are friendships, romantic or just platonic, and not having healthy boundaries. So therefore, that deaf and hard of hearing child or adult is at more risk for not knowing that they could say no, that they are empowered to have a voice. Overall, just not being able to navigate life and know that they do not have to let life happen to them, but they actually have a choice and decisions that they can actually make in their lives. Okay, so there are some additional tips that we wanted to provide for mental health clinicians. Of course, when you first have a deaf and hard of hearing consumer, you want to make sure that you are honoring and asking and figuring out what is their preferred communication mode. They may want to just communicate by using their oral speech and listening. They may want to communicate through American Sign Language and may request a sign language interpreter, or they may choose to do both. That is that deaf and hard of hearing person's choice. Also, make sure, as Cynthia said before, make sure the interpreter is certified and also qualified to be able to provide the access needed in a mental health setting. So also make sure to ask questions about that deaf and hard of hearing child or adult, their past experiences. What were their school experiences? Did they go to a residential school for the deaf and hard of hearing? Did they go to a mainstream school? Were they the only deaf and hard of hearing person in their school? Did they have peers that were like them? Also, making sure that they were included in their family life, or did they feel isolated in their family life? Did they know we were going to Christmas dinner at Aunt Joan's house? Did they know that we were going on vacation to Disney World? Or was everything in their life growing up a surprise and their siblings may have known what was happening, but they didn't? Another good thing to do is making sure you ask, did they have friends? Did they feel like they had quality connections? If they had a problem or if they had something great or positive that happened in their life, that they were able to tell someone that was their same age peer to be able to celebrate those things in those friendships. Being able to also directly ask if they have had trauma or abuse is very important. They may not know to just give you that information. So as the mental health professional, you will have to directly ask a lot of times about those past traumatic or abuse experiences. And you may also have to provide examples, choices, and also expand the language. Additionally, recognize that you may be the first person that they are disclosing their traumatic experience or abuse to. They may not have had someone to be able to communicate effectively, to tell their experience of what happened, and now that they have the communication access and an interpreter, they may be able to now process that, or their language has now developed where they now understand what they went through as something that they may have thought was their fault, that they now can actively express that. Please make sure to provide validation of their experience. They may think it was their fault. Their family may have blamed them for what happened. It may have been an embarrassing situation to the family, and the family may have also minimized it or just not believe that it happened. So it's very important that you validate their experience and make sure you let them know that it was not their fault. In addition to that, make sure that the incident was reported to the proper authorities, if that was CPS or law enforcement, because there are times when that has not happened. And of course, then you would need to proceed with those reporting to the appropriate agencies at that time. Including a multicultural perspective is also important. A deaf and hard of hearing individual that is also part of a minority community may experience trauma very differently than someone else who is not. So just think about if you are watching the news and there's images of different minority communities being taken advantage of or violence happening, they may not have the framework to be able to understand that. So they may experience that as a trauma and not just as information. And then lastly, be familiar with deaf culture and consult with deaf and hard of hearing professionals. That can be found at your local universities that have deaf programs, your local schools, or community resource centers for the deaf and hard of hearing. So now we want to provide tips for parents and educators. And these are good suggestions and tips if your child or the young adult has already experienced the trauma or abuse, or if you want to prevent trauma and abuse from happening, or if you just feel like your child is at risk. So first, just know that they are not doing it on purpose. Whatever the behavior is, or maybe the maladaptive response, that it's just something that they automatically do and they're not actually doing it on purpose. It's very important to demonstrate how to self-regulate. So if the child or adult is, yelling and stomping and, expressing anger in those ways that are not as appropriate, you may need to model what that looks like. Maybe saying, okay, you need to breathe, or you need to take a break, or being able to come and find a person to talk to about the situation. Modeling that and showing them how with that direct modeling and instruction is very important. Ask lots of questions. Allow yourself as a parent to grieve what has happened to the child and also not to blame yourself. Make sure you're sincere in whatever you're communicating to the deaf and hard of hearing individual, and make sure you are also getting support. It should not be done alone, and it's very important for you to have a support system, whether that is from your church or your family or your group of friends. There's also lots of support groups as well for trauma or abuse, so you will be able to find a group of people that may have a similar experience and be able to gain knowledge of tools and strategies that they were able to do to get through it. And make sure you refer for mental health services if that child has experienced trauma or abuse, so that they can get the right intervention and right therapy to be able to overcome it and to start the healing process. Make sure you take a break from the situation and assess the situation. Take a moment and stop and see, okay, how is my child feeling? Why is this young adult acting like that? Just take a step back and really think about what is really going on, because you may be focused on what's happening on the surface and not really realizing that there's more happening, or that they're really upset, or maybe having flashbacks of the traumatic experience, or maybe not expressing to you everything that occurred. It's also very important for children, especially, and young adults and teenagers, to make sure you know what they're doing and what they're being exposed to. Now, in our wonderful world of technology, kids and adolescents are exposed to a lot of information, some positive, some negative, through social media, the internet, YouTube. So you want to make sure that you have the safety parameters put in place. You want to be checking what your child is looking at, especially if they're deaf and hard of hearing, because they may not understand what all of that means, and they may be vulnerable or more at risk of being taken advantage of online as well. Make sure you always tell the truth and believe the individual and believe their story. Make sure you practice self-care and make sure that you're not burning yourself out. You cannot help your child or the young adult through a traumatic experience if you're not taking care of yourself first. And then lastly, make sure that you're always advocating for the deaf and hard of hearing child or adult to make sure they're getting what they need and to help them be successful. We would like to thank you for participating and watching our presentation. Cynthia and I have thoroughly enjoyed this presentation, providing you this information on trauma-informed care. Thank you.